Happy Saturday, and thank you for joining me today. Do you have a phone or a tablet or a laptop, a TV, or even a newspaper? Well, if you do not have all of these things, there is a good chance that you have at least some of these things. And if you have a phone or a technological device right now where you can search things up, go to your search engine and type your state, then put coronavirus, then press enter. For instance, if you live in Texas or Idaho, press Idaho, then put coronavirus, then press enter. How does your state's epidemic look right now? What are local officials saying right now in your state? How many hospitals have reached capacity in your state with doctors and nurses begging people to stay home? Are you adhering those desperate pleas and wearing a mask and staying home? Now, if you have a TV, try watching your local TV station or try watching your local news channel sometime. They will report on the coronavirus. When I do research for this show, a lot of that information that I absorb comes from local reporting. And if you don't have a TV or cable news, or if you don't have a TV or cable, then subscribe to your local news channel on YouTube, and you will be notified every time they post a new video. If you receive newspapers, don't just leave it sitting around. If you actually open it and begin to read it, there is a good chance that you will learn more about what's happening in or around your community, but you will also see information on the coronavirus pandemic. And for me, I have been looking at my local newspapers, watching local news, searching up how my state's doing and trying to stay up to date on this information. And looking at the headlines from my local newspaper just this week has been terrifying. This was Monday, November 30th. Quote, South Carolina continues to rise. South Carolina cases continue to rise. Positive tests at 12.7%. This was Tuesday, December 1st. Quote, South Carolina reports high percentage of positive tests. This was Wednesday, December 2nd. Quote, virus cases in South Carolina continue upward climb. This was Thursday, December 3rd. Quote, SC COVID-19 case continues spike as DHEC plans to release first vaccine doses mid-December. End quote. This was just yesterday. Quote, as daily cases continue to rise, percent positivity spikes. And then this is today. Quote, South Carolina hits new coronavirus case peak. End quote. This morning, I woke up to the terrifying headline at the Post and Courier. I received that notification on my phone saying that South Carolina has just reported more than 2,777,000 coronavirus cases. For a while now, we have been reporting just more than 1,000 coronavirus cases, and that trend has continued. Now it does look like we have exceeded that number. And all the reporting that I just read to you, that was reporting from my local newspaper, the Post and Courier. Also here in South Carolina, our positivity rate is more than 23%. So as I said, a terrible week, right? I mean, when I opened the newspaper on December 3rd, I did not expect to see this headline. This is another headline as I read more into the newspaper on December 3rd. Quote, nurses wanted. Hospitals scramble for pandemic help. The article continues, quote, U.S. hospitals slammed with COVID-19 patients are trying to lure nurses and doctors out of retirement, recruiting students and new graduates who have yet to earn their license, and offering eye-popping salaries in a desperate bid to ease staffing shortages. With the virus surging from coast to coast, the numbers of COVID patients in the hospital with the virus has more than doubled over the past month, to a record high of nearly 100,000, pushing medical centers and healthcare workers to the breaking point. Nurses are increasingly burned out and getting sick on the job, and the stress on the nation's medical system prompted a dire warning from the head of the Centers for Disease Control and Prevention. Quote, the reality is December and January and February are going to be rough times. I actually believe they are going to be the most difficult time in the public health history of this nation. That's according to Dr. Robert Redfield. Dr. Robert Redfield, the head of the CDC, said that. The director of the CDC said that just this week. So this is where we are right now. I told you that on last Saturday's episode, when I essentially put this as the title of the episode, time to prepare for worst case scenario as millions just traveled for Thanksgiving. I was not being hyperbolic about that. I mean, just look at your state right now. How is your state doing with this pandemic? A health professor just told CNN that Thanksgiving coronavirus surge could turn into the Christmas surge. Physicians are now alerting everyone that these will be the, quote, darkest days of modern American medical history, end quote. And our frontline healthcare workers are exhausted. Our hospitals are reaching capacity. If you have stopped listening to them, now is a good time to rethink that. Listen to these frontline healthcare workers working from Utah right now. This is a video released earlier this week from the Intermountain Healthcare YouTube channel.
I've been working at Intermountain for 24 years. I'm 22 as a nurse, and this year has been by far the most challenging as far as the effects of COVID on our community and our patients. We've also watched patients pass away with families at bedside and have been able to support them, but it looks different. You know, they're in masks, they're in gowns, they're in pampers. It's not the typical goodbyes that we see that are so intimate and personal, and that's been difficult to watch, to take the humanness out of the dying process.
We've also had a lot more intubated patients than we've ever had in this ICU. They have a breathing tube, which is a tube that goes down their throat to help give them ventilation and oxygenation for weeks on end because of the serious illness. We also put them on their bellies to help them breathe better, but with it, it takes 5 caregivers minimum to put them on their belly, and so we've had caregivers come in on their days off to help make that a success so we can get the best patient care to these patients.
We had a patient who came in positive with COVID, and unfortunately multiple members of their family were positive as well, including a sister. So we had sisters 3 rooms apart getting high levels of oxygen, and for that sister who was ill herself to have the oxygen and the care that she needed to be safe, but to be able to hold her sister's hand as she was leaving this life. And we felt like that was a very powerful moment, but also very hard to watch, considering that this disease takes havoc on families and can create a lot of loss just among an immediate family.
Several people in Utah now don't have the opportunity to have their family members with them this holiday because they did pass away from coronavirus. So we kind of just have to think about that. Sacrifice now for the next year and the year after that and the year after that to keep those family that you love, by you.
I know there are a lot of people out there who have opinions regarding COVID, and I know there are a lot of people out there that think masks are not effective, but I promise you they are. If masks weren't effective, then all of the healthcare workers would be dropping like flies, but we're not.
We can still take great care of people, but it's just getting harder and harder to do it because there are only so many of us, there are only so many beds, and we could really use the public's help in just trying to slow things down a little bit so we can hopefully just continue to take care of people at the level we want to. But unfortunately, we do have limited resources, and they're being very taxed right now, and we're all really tired.
I might get sick, but I realize that I'm not the person that's going to be admitted to the hospital necessarily. But I really have to step back and say, I don't want that to be my mom or my dad or your mom and your dad.
Please wear your masks, wash your hands, social distance, and stay within your family that you live with in your home. Please be a part of the solution.
Please be a part of the solution. Once again, frontline healthcare workers in Utah speaking about the coronavirus situation right now. That video was released earlier this week by the Intermountain Healthcare YouTube channel. In Utah right now, things are getting progressively worse. On Thursday, they surpassed 200,000 coronavirus cases and 17 more deaths. Their positivity rate is more than 24% right now. This was the headline at the Desert News earlier this week. Quote, worst COVID-19 days likely ahead as Utah places first order for breakthrough vaccines. End quote. Earlier this week in a health briefing, Utah's Governor Gary Herbert said, quote, we're on the verge of a breakthrough. End quote. He also said that a vaccine could be delivered to Utah by December 15th. Then he said this, quote, it's easy to be discouraged. This pandemic has lasted a long time. In the springtime, we'll be on the road to recovery. So please persevere, stay committed, stay strong, Utah, and we'll get through this together. End quote. Yesterday, Utah reported more than 3,000 coronavirus cases, and we have just learned that nearly 1 in 4 Utah coronavirus tests return positive. Essentially, they come back positive. In New York right now, they are trying to avoid another essentially disastrous April. At a hospital in Syracuse, New York, Dr. Robert Corona, the hospital's CEO, said this, quote, "Our people are seeing numbers they've never seen before. They are being asked to do more. They are going into their shifts tired, and they are leaving work exhausted. We may have to turn people away from upstate New York, and they may have to go to institutions where they don't have the medications and experts we have. It could really impact the ability to care for the sickest people." End quote. Once again, Dr. Robert Corona is speaking about the surge in cases in his hospital specifically being overwhelmed at this point in the pandemic, as nationally we are suffering a third wave. Reporter James Mulder at Syracuse.com broke that story earlier this week. In New Jersey, this was the headline at NBCNewsNewYork.com. Quote, "Everything is on the table. New Jersey smashes daily case record exactly 9 months after reporting first." End quote. Today, the state of New York reported 5,367 new coronavirus cases and 53 deaths, which is more than half of all of November's deaths. In New Mexico, there are more than 104,000 coronavirus cases and 1,706 deaths, and their hospitalizations are just jarring. Yesterday, Yahoo News reported that New Mexico hospitals are currently at 102% are currently at 102% ICU capacity. Yahoo News reporter Christopher Wilson reports, quote, as COVID-19 case numbers soar across the nation, hospital ICUs are reaching and in some cases exceeding capacity, according to an internal government report obtained by Yahoo News. New Mexico has reached a 3-day average of 100.19% of staffed adult ICU beds, and other states are not far behind, according to a December 3rd COVID-19 senior leadership brief. While New Mexico has the highest 3-day average, the Department of Health and Human Services reported that 5 other states, Arkansas, Idaho, Missouri, Oklahoma, and Rhode Island, are using 70% or more of their ICU beds and have also seen sharp rises in the number of patients over the past 14 days. Dozens of other states are also seeing or already exceeding 70% capacity. End quote. A doctor in San Francisco, California, said that they could run out of ICU beds by December 26. Dr. Grant Colfax said, quote, if this trend continues and we do not slow the spread of this virus, we will be unable to care for the people in San Francisco's hospitals. End quote. In the state of California, there have been new shutdowns as the state is currently seeing a surge in coronavirus cases. Specifically in California, when you talk about like leading by example, when you tell people to do something and then you do it, that is leading by example. Multiple Democratic officials in California have been accused of hypocrisy after essentially just telling people to do this and then they do otherwise. Specifically, their governor and also the mayor of San Francisco essentially were spotted out with their family members and attending other internal events where people are congregated. Also, New York's governor, Andrew Cuomo, was also accused of hypocrisy. That was just earlier. And essentially, the governor did not actually go through with this after receiving backlash, because the backlash, I guess it was so large. But that is what's going on right now. In the state of New Mexico, there are currently 934 people hospitalized. Their governor, Michelle Lujan Grisham, imposed a 2-week shutdown right after Thanksgiving. According to Oriana Gonzalez at Axios.com, we know that as of today, New Mexico is about to allow hospitals to, quote, start rationing medical care, end quote. In Texas, they are continuing to report tens of thousands of new coronavirus cases. Specifically in Houston, Texas, this was a local report from KPRC News on Thursday of this week.
With the surge in cases and hospitalizations across the country, there is growing concern about COVID-19. Now, Mayor Sylvester Turner is talking about a possible curfew in the city of Houston to help fight the spread of the virus. Channel 2's Vincent Crivelli has more.
Good afternoon. Yeah, the key word here is possible. Mayor Turner is letting Houstonians know that he's mulling over the idea of a curfew. Some Houstonians like the idea, others do not. A tweet from Houston Mayor Sylvester Turner sent shockwaves across our area.
We'll take a look at people's behavior. We'll take a look at the degree of community spread.
Turner says coronavirus hospitalizations have more than doubled from 6 weeks ago, and he's considering implementing a curfew.
Looking at the number of people in the hospitals, looking at the positivity rate, and then taking a look at people's behavior. When you consider all of those factors, may come to a point where you say, okay, this is where we impose a curfew.
Houstonian Joshua Daughtery is not a fan of a curfew.
I think that I'm grown and I'm not going to stay in my house.
He says if a curfew is implemented, he plans to break it.
Sense of freedom's being taken away and things are being imposed on us that we shouldn't have to endure.
However, not everyone agrees.
I think it's great. I think that the state opened up way too soon and that the virus spread rather quickly.
Veteran Deborah Mann is a healthcare provider.
Put everybody at their home and let's get this disease under control.
And for the people that say that's infringing upon their liberties, what would you want to tell them?
Listen, they don't have any liberties if they're dead.
And Mayor Turner is holding a press conference at 3 o'clock this afternoon to discuss coronavirus updates. I'm told the conversation will be focused on vaccinations. Reporting in Houston, Vincent Crivelli, KPRC, Channel 2 News.
Speaking of vaccines, we have just learned that the grocery store Kroger will be providing coronavirus vaccines in the Houston area and nationwide. Another piece of important news came from Houston, Texas this week. This was reporting from KHOU 11 News on Thursday, December 3rd of this week.
Harris County Judge Lena Hidalgo is asking public health officials to review their contingency plans in case hospital systems do get overwhelmed. As Adam Bennett shows us, it is a possibility if current COVID-19 trends continue.
As the number of COVID patients in local intensive care beds rises, so does the concern of county officials.
And the increase is accelerating dangerously.
Harris County Judge Lena Hidalgo said 17% of the county's ICU population is COVID positive.
So if that acceleration continues, then we're going to get to where we were in June, July, or worse, to an El Paso type situation.
Judge Hidalgo says the limited supply of vaccines arriving mid-month won't be enough to keep hospitals from being overwhelmed if the trend continues. This afternoon, she ordered relevant departments to be ready in case that happens.
Making sure that we've got the beds in our public hospital system, that we're ready to increase their capacity as we did back in June, July, that we've got the tests, as many as we can have, that our emergency shelter at NRG is ready to stand up within 48, 72 hours.
Judge Hidalgo says she's looking at all options. Both her and Houston Mayor Sylvester Turner say Governor Greg Abbott's orders limit them.
We are not driving this car. County judges and mayors are more like passengers.
This week, Mayor Turner said a citywide curfew is a possible last resort.
That's a nuclear option.
Judge Hidalgo says that option's also on the table for her, but worries it's a short-term fix. This week, a spokesperson for Governor Abbott said that recent efforts in El Paso show that the state's plan works. His office is urging Texans to follow the same safe practices from the summer. Judge Hidalgo agrees that our actions are a key part.
We as individuals, members of the community, we can change that.
In slowing the spread again. Adam Bennett, KHOU 11 News.
Once again, now's reporting from KHOU 11 News about Harris County Judge Lena Hidalgo and a potential increase in coronavirus hospitalizations in Houston, Texas. And if essentially that is about to come, hospitals, please start preparing. Essentially, that's her warning there, and that's her essentially request of them. Today in the Commonwealth of Pennsylvania, they recorded 12,884 new coronavirus cases statewide. They have more than 411,000 coronavirus cases. You may recall last weekend when health experts were concerned about recent model projections. Those projections showed that the state of Pennsylvania could soon be reporting more than 20,000 cases a day in mid-December. Well, just looking at today's numbers, that does appear where they're headed. But as the state is continuing to grapple with this new exponential increase in coronavirus cases, Pennsylvania Democrats are proposing a COVID-19 relief bill. Now, we know that this bill is a $4 billion plan to allow to assist Pennsylvanians grappling with the coronavirus pandemic and also to help out small businesses. And this will be really, really, really beneficial, especially given Pennsylvania's COVID-19 numbers right now and the current situation in that state. This was a local news report from WGAL News yesterday.
State Senate Democrats today introduced a multi-billion-dollar pandemic relief plan.
WGAL News 8's John Bork tells us about it.
Saying they can no longer rely on federal funding, the state Senate Democratic caucus has laid out a $4 billion proposal to help struggling Pennsylvanians and small businesses.
But we're going to continue to fight for the people of Pennsylvania because we know that the need is there, and that's what this is about.
Tops on that list is $1 billion earmarked for unemployment compensation.
That unemployed benefit that we're talking about is about 6 weeks of additional money at about $350 a week for about 509,000 workers who are about to fall off the federal system right about now.
With funding on the table for education, housing, and food, Senate Democrats are looking to pass their $4 billion spending bill before the next General Assembly is sworn in.
That we can move quickly on January 5th and then maybe no later than the second week of January to actually get something passed because of the legislative timing.
Democrats say Republicans on the other side have been more focused on the state's budget shortfall. But for PA CARES Act 21 to succeed, it would need bipartisan support. In Harrisburg, John Bork, WGAL News 8.
All right,
Once again, a local news report from WGAL News 8 yesterday on the possibility of a COVID-19 relief bill for Pennsylvania residents and small businesses. In Minnesota today, they reported 6,377 new coronavirus cases and 75 more deaths. The Minnesota state legislature has just added more committees on COVID-19. Also this week, Minnesota health officials and their governor adulated the National Guard during a COVID-19 briefing. Nationally, the situation is just getting increasingly worse. Earlier this week, the CDC warned of 450,000 Americans could be dead by February of next year. Meanwhile, the Trump administration is remaining relatively silent on the coronavirus pandemic. When asked about a coronavirus stimulus bill, their response was, quote, "We don't believe the recovery is in jeopardy," end quote. The Biden transition team has just asked Dr. Anthony Fauci to stay on. Also this week, in an interview with Yahoo News, Dr. Anthony Fauci warned about the veracity of the impact of those massive Thanksgiving gatherings and travel that we saw. Just recently, he warned that things will begin to get worse as we head into this colder season, and that hospitalizations and deaths will continue to surge in the weeks ahead. He said, quote, "You do the math on that. 2,000 or 3,000 deaths a day times a couple of months, and you're approaching a really stunning number of deaths," end quote. This week, Politico reported that the Trump administration is just leaving it up to states on how they want to distribute vaccines. Health experts are now urging people who traveled for Thanksgiving to get tested and stay home. Dr. Fauci is also warning that January, quote, "is going to be terrible," end quote. Yesterday, the United States recorded more than 3,000 coronavirus cases. We are continuing to report more than 200,000 coronavirus cases. Most recently, we reported 210,000. More than 14 million Americans have the coronavirus, and more than 279,000 are dead. 1 American dies from the coronavirus every 32 seconds. So as I said at the beginning, check your phone, right? Check your laptop, your tablet, read your local newspaper, watch your local news channel, and look at what's going on in your state. Look at what's happening right now. Because things are getting worse, and you must stay informed. But there's one thing that I want to leave you with as we head into commercial break here. As you know, as if someone is getting ready to die, or if they are about to die, you will just hear that machine in the emergency room play, like beep, beep, beep. Well, if that person is dead, it is no longer a beep, beep, beeping. It is this sound. Many frontline healthcare workers have heard that sound. More than 279,000 people have died, and that sound has been played that much times. Just think about that for a second. That much times, that sound has been played. That devastating, jarring, loud sound has been played. And frontline healthcare workers are hearing that. So when they are telling you to stay home and to protect yourselves and not to travel for national holidays, that is for a reason. Hospitals are reaching capacity. They are literally, our frontline healthcare workers are literally overwhelmed. So please, please stay home. The situation here in the United States is exacerbating. And no frontline healthcare worker wants to hear that sound. No one. But they are hearing it again and again. We'll be right back.
In this world where people are staying at home, many of life's moments are being put on hold. At Carvana, we understand that for some, getting a car just can't wait. That's why the new way to buy and sell a car is also the safer way. At Carvana, you can do it all 100% online from home, with a touchless delivery and pickup process to keep you safe. And for even greater peace of mind, all Carvana cars come with a 7-day return policy. So if you need to keep moving, it's our goal to keep you safe. Check out Carvana, the safer way to buy a car.
47 died and millions of dollars in property was destroyed by the terrific storm which swept the Atlantic coast, leaving raging floods in its wake. In New York, 3 children and 2 women marooned on Esopus Creek were rescued. Towns in Maryland and Delaware were hard hit, the rising waters isolating houses and cutting off whole communities. The only way to reach home in some spots was to swim for it. At Laurel, Delaware, the drawbridge was raised when the swollen stream threatened to carry it away. All along the coast, buses and other cars were stalled on the highways, hub deep in the water. Virginia Beach near Norfolk bore the brunt of the gale, which battered summer cottages to bits and whipped waves inshore with hurricane velocity, even bringing bathtubs out of retirement. Atlantic City's boardwalk looked like this after the storm, and other coastal towns were turned into replicas of Venice. Cape May's streets became popular swimming holes, and the youngsters had a grand time navigating around the town. The fishing pier was smashed to pieces by the raging surf, and when it was all over, only a few shattered piles remained. 2 died and 17 were injured when the Crescent Limited was wrecked near Washington, D.C., plunging from a weakened trestle over the Anacostia River. The flyer toppled down the embankment, and some of the passengers in the sleepers narrowly escaped drowning as the waters rushed into the cars. The engine itself was buried deep in the mud, causing the death of both the engineer and fireman.
That was reporting from 1933, Hurricane Havoc. That was reporting from 1933. 1933 is one of the most active hurricane one of the most active hurricane seasons in hurricane history. Then came 2005, another very, very active hurricane season. Then came 2020. And on Monday of this week, hurricane season finally concluded. It was so much a jubilant occasion, I especially imagine for meteorologists at this point. Here's actually the front page of the Post and Courier, our local newspaper here in South Carolina. Quote, "Hurricane season, one for the books." Here's the subheadline, quote, "A look at this year's record-smashing weather events." And then it goes on. This is by reporter Chloe Johnson at the Post and Courier. Quote, "The 2020 hurricane season is coming to a close, but it's one for the record books, leaving prior benchmarks far behind in the statistics heavy field of tropical meteorology. This year saw earlier than usual storms that grew stronger later in the year and saw way more storms, period. This season wasn't just notable for its records, either with a high human cost, as some storm victims were repeatedly ravaged. 2 unfortunate stretches of coastline were hit multiple times, weeks or even days apart. It's an exceptional season that will officially close on Monday. While it's official, While it is possible for cyclones to spin up any time of the year and possible that this hyperactive season won't obey its end date, it's still a good time to stop and take essentially a look of the remarkable 6 months. And then, end quote. And then she goes on to essentially just lay out there, once again, reporter Chloe Johnson at the Post and Courier reporting with this piece. And then she goes on to lay out there this very, very active hurricane season. So it has been a long, long time. Hurricane season began in June. On November 30th last month, it officially ended. Monday this week, hurricane season officially ended. Very, very active hurricane season. 1933 was at the top there. Then 2005 came. And now 2020 is one of the most active hurricane seasons in history. You may recall that right after Joe Biden won the presidential election on November 7th, 2020, I believe that was the day that I posted the episode. Right on that day, I also spoke with a meteorologist on that episode. He is DTN's chief meteorologist, Jim Forrester, and I spoke with him about this year's very, very active hurricane season. Here's what he told me. So we have seen many hurricanes this year. Could you explain why that is and what exactly this means?
We saw an above average year for storms. We had predicted this back, before the season began. A lot of the things that we look for were all coming together. And one of those big factors was the warm water temperatures, where these storms usually form off of Africa and then over towards us, towards the Caribbean and the Gulf. That whole area was, and still is, very much warmer than it usually is, that historically has been, and that in combination with some upper air patterns that were favorable, really looked like it would be an above average year. And sometimes we look at the maps and they're not favorable. There's different things. The temperatures are cold or something like that, but in this case, everything came together and it looked like it was going to be an active year. So the main factor really is the warm waters.
Once again, that was an interview that I conducted on November 7th, 2020 of this year. Essentially speaking with Jim Forrester, the DTN's chief meteorologist, about this very, very active hurricane season. Once again, hurricane season has now concluded. As of Monday, November 30th, hurricane season has concluded. And as Chloe Johnson at the Post and Courier writes, this is a record hurricane season for the history books. We'll be right back.
Hi, Grandma. At a time when we're asked to sacrifice, we step up to do our part. On the home front, on the front lines, to lend a helping hand and hold each other up. We are resilient, vigilant, and we'll get through this because we're better together, even if we're a little farther apart.
This is reporting from immigrationequality.org. Quote, On June 15th, 2012, President Barack Obama created a policy called the Deferred Action for Childhood Arrivals, otherwise known as DACA, calling for deferred action for certain undocumented young people who came to the United States as children. Applications under the program began on August 15th, 2012. Deferred action is a discretionary limited immigration benefit by DHS, the Department of Homeland Security. It can be granted to individuals who have never been in removal proceedings, are currently in removal proceedings, or have final orders of removal. End quote. So DACA has been very, very beneficial for lots of people. It's been very beneficial for immigrants who are trying to come into the United States or have only known the United States as their home. Once again, now is reporting from immigrationequality.org. Well, the Trump administration has just been at this fight for just a very, very long time, trying to just essentially get rid of DACA. Essentially, the president's anti-immigration agenda during his 2016 presidential campaign, yes, that has transpired. That DACA was created under President Obama's administration. Well, just before President Obama left the office in 2016, just before he left the office of President of the United States in 2016, President Obama warned President-elect Trump about overturning DACA.
On the deferred action program that we have known as DACA that relates to Dreamers who are currently benefiting from these provisions. I will urge the President-elect and the incoming administration to think long and hard before they are endangering the status of what, for all practical purposes, are American kids. I mean, these are kids who were brought here by their parents. They did nothing wrong. They've gone to school. They have pledged allegiance to the flag. Some of them have joined the military. They've enrolled in school. By definition, if they're part of this program, they are solid, wonderful young people of good character. And it is my strong belief that the majority of the American people would not want to see suddenly those kids have to start hiding again. And that's something that I will encourage the President-elect to look at.
Once again, that's former President Barack Obama in 2016 urging the President-elect Trump to take a closer look at this before he decides, hey, yes, this needs to be overturned, especially given his anti-immigration rhetoric on the campaign trail as he is running for president in 2016. So that was, once again, former President Barack Obama urging the President-elect, take a closer look at this before you ultimately decide to overturn it. The Trump administration has been at this for a while because now we do have President Donald Trump instead of President-elect Donald Trump. The Trump administration has been at this for a while, and in some attempts, they have just been unsuccessful. You may recall that Supreme Court fight that took place earlier on this summer, I believe it was in July, when the Supreme Court essentially did not overturn DACA. Essentially, that did not happen. It was a victory for lots of immigrants in this country. And then last month, we got this notification, we got this piece of news that a federal judge said that the acting Secretary of Homeland Security, Chad Wolf, was serving illegally, and that the DACA program should immediately be back up. And then we got this news yesterday. A federal judge has reinstated DACA, telling the Trump administration and the acting Secretary of Homeland Security that they need to start accepting new applications by Monday. This was a local news report today.
Thousands of DACA hopefuls will soon be able to apply for the program once again. The Trump administration had blocked those applications, but a federal judge ordered the government to restore the program today. Our ABC 10 News reporter Laura Acevedo spoke to a San Diegan who is now waiting to apply.
The Department of Homeland Security has not commented on the ruling. They have 3 days to comply with the judge's order. Friday, the latest blow to the Trump administration and its fight to end DACA, a judge ruling that the administration must once again start accepting new applications and return to 2-year renewals. DACA, or Deferred Action for Childhood Arrivals, gives legal protection to undocumented immigrants brought to the U.S. as children by their parents. Jacob Sapochnik is a San Diego immigration attorney.
As I'm talking to you, I'm getting all these text messages from people, and they want to know.
For one San Diegan named Harrison, today's news means he can now apply.
We won't be scared of facing that ghost of deportation anymore.
Harrison did not want to show his face out of concern because of his legal status. His parents left their home country of Guatemala when he was 4.
It's very impactful towards me because I now know that I can have a better future, not only for me, but for my family.
The Trump administration first tried ending DACA in 2017, but in June of this year, the Supreme Court blocked its attempt. Now the Department of Homeland Security has until Monday to post public notice on all of its websites that it's accepting first-time applications and renewals following all the terms in place in 2017.
The government, they potentially could file, an appeal, or maybe some kind of a motion to block this from happening.
But Sapochnik doesn't think the administration will appeal. Instead, he's planning on helping thousands apply.
I think it's just important to know that it's going to create an influx of bright people that are going to join our workforce, and I think it's exciting to see it.
Laura Acevedo, ABC 10 News.
Once again, a local report from ABC 10 News on essentially a federal judge saying that, yes, DACA can be reinstated, and also you have until Monday to start accepting applications again. All right, much more ahead tonight. Stay with us.
Meet the Ninja Foodie Air Fry Oven. Make fast, family-sized meals in the time it takes some ovens to preheat. With Ninja's superheated air, you can air fry for extra crispy, guilt-free, delicious results. And because it's a Ninja Foodie, it can do things that no other oven can. And even flip up and out of the way. The Ninja Foodie Air Fry Oven, the oven that crisps and flips away.
In 2001, William J. Levine II enlisted in the United States Army. 6 years later, he graduated from the Special Forces Qualification Course and was later assigned to the 1st Special Forces Group with another assignment to the United States Army Special Forces Operations Command. He would deploy multiple times to Iraq and Afghanistan in advocating for the global war on terrorism, while he was assigned to the United States Army Special Operations Command. He received awards and decorations, including 2 Bronze Stars, one with Bronze Star Medal with the V device. Well, 37-year-old Major Sergeant William J. Levine II was found dead at Fort Bragg at a Fort Bragg training area on Wednesday. He wasn't the only one. So was Army veteran Timothy Dumas. He was 44 years old. According to officials, he previously served at Fort Bragg from 1996 to 2016. He served in the Army as a property accounting technician. We also know that he deployed to Afghanistan at least 4 times. He too received the Bronze Star Medal. On the death of Major Sergeant William J. Levine II, Army officials are devastated. Lieutenant Colonel Justin Duvall, the commander of the United States Army Special Operation Command's headquarters, said, quote, "The loss of a soldier is always tragic. Major Sergeant Levine dedicated himself to the Army for 19 years and deployed multiple times in the defense of our nation. Our condolences go out to him and his family during this difficult time." End quote. We know that both of their bodies were found in the training area at Fort Bragg. The Army does not yet know the cause of their deaths, but it is currently under investigation by the U.S. Army Criminal Investigation Command. The last note is next.
Hey Google. More than 100 billion words are translated every day.
Lift your hand.
Thank you very much for your help.
Words about food. Words about friendship. About sport. About belief. About fear.
Oh my God.
Words that can hurt and sometimes divide. But every day, the most translated words in the world are "How are you?" "Thank you." And "I love you."
So the day before it happened, there was a bunch of hype and speculation about what may come next. People were fixated on their television sets, senators and representatives were chatting about it, and then we learned that the vice president was summoned to the Oval Office.
In his near resignation from office, this morning he called into the Oval Office room Vice President Ford for a private conversation. That meeting is going on now in the Oval Office. The White House News Corps has been told to stand by for a background briefing. Mr. Ford's planned trip to the West Coast and on to Hawaii that was to have begun at 4 o'clock this afternoon has been delayed, they say now, until later this evening or tomorrow. We repeat, President Nixon has called Vice President Ford into the Oval Office room for a private meeting amid rumors in the nation's capital that the president is about to resign. CBS News will be standing by to bring you further details through the day. This has been a special report from CBS News in Washington.
That was a CBS News special report on the night of August 8th, 1974. And at this point, the entire nation, congressional members, and others were captivated by the Watergate scandal, especially congressional Republicans, right? I mean, the fascinating hearings had already taken place. Nixon feared impeachment, and to avoid that, well, the next day, it was pretty clear that this is going to happen.
I have never been a quitter. To leave office before my term is completed is abhorrent to every instinct in my body. But as president, I must put the interests of America first. America needs a full-time president and a full-time Congress, particularly at this time with problems we face at home and abroad. To continue to fight through the months ahead for my personal vindication would almost totally absorb the time and attention of both the President and the Congress in a period when our entire focus should be on the great issues of peace abroad and prosperity without inflation at home. Therefore, I shall resign the presidency effective at noon tomorrow. Vice President Ford will be sworn in as president at that hour in this office.
That was August 9th, 1974. President Richard Nixon resigned, giving his speech in the Oval Office there. But after Nixon resigned, Congress passed lots of bills that ensured ethical behavior and to make sure that something like Watergate would never happen again. And after nearly 4 years under the Trump administration, our democratic republic has been subverted, our institutions have been vehemently attacked, and the rule of law is crumbling. And many have advocated for that to happen as soon as the president leaves office. New legislation that will further protect our democratic republic, ensure these egregious acts of misconduct and corruption do not happen again. There are 46 days to the presidential inauguration. But we actually do have some breaking news tonight. As of today, the United States has reached more than 228,000 coronavirus new cases. Just devastating. Please stay home. Wear your mask because it will really save lives, and it really does help. Thank you so much for listening to this episode of The Jeremiah Patterson Show. Don't forget to share this podcast with your family and friends. Also, go check out my other podcasts, U.S. Presidents and DISGRACE. U.S. Presidents is about the life and presidencies of each president from 1 through 44 and soon 45. And DISGRACE is a podcast about Watergate and the downfall of Nixon's vice president, Spiro Agnew. With that said, thank you so much again for listening to this episode of The Jeremiah Patterson Show. Have a great evening, and I'll see you tomorrow.